bimanual. So if you're assessing the inferior border, push down, palpate all the way here, this way,
If they have what breast?
pendulous. If you have now, if you're assessing now the superior aspect, push up, palpate deep. Okay, bimanual palpation. Now, after you do palpation of both breasts, now you will need to palpate the lymph nodes. So, lymph nodes will be infraclavicular, supraclavicular. What is this? Inframammary nodes, internal mammary lymph nodes, and you have the axillary. Now, when you're assessing the axillary lymph nodes, so your patient is initially positioned this way, right? So you ask your patient, okay, can you bring down your hand or your arm? Continue to palpate. Okay. When the arm is in this position, the lymph nodes are pushed towards the back. So what's going to be covering this area? Portion of the muscle as well as the skin. So you need to palpate really deep to be able to feel the lymph nodes if there are palpable lymph nodes. But if the patient brings down the arm, the lymph nodes are now pushed forward. And so if present, it will pop. You'll feel that the lymph nodes touching your fingertips. Okay, so it's important that you ask them to bring it down. Okay, so these are the lymph nodes. Again, do the same on the opposite side. All right, so we need to teach our patient self-breast exam. Okay, we said between days 4 to 7, from a shower, they need to assume those different positions. Okay, looking initially at the contour, size, shape, any retractions, looking for that. Then they need to lie down, palpate. Okay, they need to sit up, palpate again with the arm raised, and then palpate these areas, the lymph nodes. You just tell them, it's a feeling of like they're small marbles, small seeds in these areas. Okay, so that is what they call this, what they need to do on a monthly basis. Okay, now, if you have a patient and this patient has had a bilateral mastectomy, okay, for cancer, and that was, let's say, half a year ago, the patient asks you, do I still need to do a self-breast exam?
Yeah.
Okay. But there is no more breast tissue.
That's okay. You still have to do it.
There's nothing there. What am I palpating?
The lumps.
Yes, but there is no breast tissue. Do I need to palpate the entire thing?
You have
There
to
is
do
nothing.
the
Yes.
ventricular and axillary.
Yes, but what I'm saying is the breast tissue it's gone.
Right.
Okay. When you have a mastectomy, okay, all the breast tissue is taken out.
So you can't get breast cancer again?
I'm asking you. The patient is asking, nurse, should I?
Yeah, I say yes. Make sure they don't have no cysts or.
But where?
No.
Right
Yeah.
here?
Lymph node along the incisional site. Okay, so if the incisions were done here, that's where you will palpate, because that's where there will be some remaining breast tissue. Okay, there's nothing here. If this is not the incision, there's nothing here. Even the muscles are removed. So really, you'll see if there is no cosmetic, surgery done, you'll see like an
Flat.
excavation here, a depression here, nothing here. But where you have the incisional site, that's where you need to palpate for any lumps, because that's where some breast tissue may be left behind. Okay. Now, if the patient says, I had a breast augmentation, okay, should I do a self-breast exam?
Yeah.
Yeah.
Yes. Okay. They will be able to feel the implant. Okay. They do it gently, of course, but they will still be able to feel the breast tissue itself, because the breast implant usually will be like in a bag. Okay. You will be able to feel the borders of that, and the rest will be still breast tissue. Okay. Now, patient says, I'm in my 40s. Okay. When will you recommend a mammogram for me?
Now,
Now,
Okay. So we usually recommend at the age of
35.
40.
40. Okay, at 40. That means no risk factors. Okay. How often?
Yearly?
Yearly. What time of the month? The patient says, what time of the month, nurse, is best?
During your period?
Yes.
Spring.
Between days 4 to 7. Okay, why? Because that's when hormonal levels are low. It's going to be less painful. Okay, because when they go, towards when they're about to have their period, the breasts are very tender. And remember, when they do a mammogram, they squeeze the breasts. And so it's going to be very tender. Okay. The patient says, do I need to fast? When I have a scheduled mammogram tomorrow, what are some reminders, or what is it? What do you call them?
Pre-op instructions.
Okay, pre-mammogram instructions.
No deodorant.
No deodorant.
No
Take a
deodorant.
shower. No
Okay.
tight clothing.
Because you have to remove it.
Yeah.
Okay, so no deodorant. That's one important thing. They always say, as much as possible, do not apply anything, because it's calcifications that we are looking for, that they look for, and those calcifications mean that there might be a cancerous change. Okay, so those deodorants, especially, it's aluminum.
Mhm.
Okay,